Hi, my name is Melissa Magyar. I'm a registered nurse and the owner of Inner Swan Aesthetics in Stillwater. I'm going to be performing laser hair removal today on Gina. She has nice, dark, thick, coarse hair in her legs that she would like to remove. Dark, coarse hair is the easiest hair to treat because the laser is actually attracted to pigment. And so I'm going to be using a 755 nanometer wavelength, which is attracted to browns and reds in the skin, and especially this dark hair. And so what I'm trying to do is put enough heat down into those hair follicles that it permanently destroys the bulb and the bulge, which is the main part of the hair. And so after about 2 weeks, the hair follicle will fall out, and it should not grow back if we put enough heat in there. There are millions of hair follicles all over the body, and they're going through one of 3 stages of growth at any given time. We can only destroy the hairs that are in the active stage of growth. It's either in the active, resting, or kind of transition stage and falling out. And so we usually, on the face, the hair grows a little bit faster. So on the face, you usually do hair removal every 4 to 6 weeks, versus on the body, and sometimes even on the legs, take up to 12 weeks for you to start growing enough hair to come in for your second treatment. So the hair in the body grows a lot slower. And usually a series of 6 to 10 treatments is pretty average. This is going to be her first treatment. Usually after the first treatment, it'll thin out the hair significantly, and then with each treatment, you're going to produce less and less hair. So the goal of hair removal is not to permanently wipe out every hair. That's not possible because there's just so many hair follicles throughout the body. But the goal is after a series of laser hair removal treatments, the hair will be significantly much more manageable. It'll be much more manageable to shave, and you won't have to shave as much or as often. So we previously did a little test patch on Gina. I wanted to see how her skin responded. What we're looking for is the skin, if you're using the appropriate setting, will get mild to moderately pink. And then if you scan in close here, you can see all the little hair follicles have popped out a little bit. There's just a little bit of swelling around each hair follicle. So this is a really good response to laser. That means we're using enough heat that those hair follicles will be destroyed. And so I'm going to continue on and just do each grid. And I like to mark off as I go along so that I don't forget where I've been. And so after the treatment, since we're using a lot of heat, Gina will not want to take any really hot baths, not sit in any saunas or do any vigorous exercise for about 24 hours, because then she could potentially develop blisters, and we don't want that. We don't want blistering. That's not common. So as long as she keeps it cool the rest of today, she'll be just fine. And I do recommend putting some cool compresses on the treated area afterwards to just get that heat out. We initially want to put the heat in there to destroy the hair follicle, but once the hair follicle has been destroyed, we want to cool that skin down, because if you leave that heat trapped in the skin for too long, it can actually wake up dormant hairs that are just kind of sleeping in kind of a dormant stage. It can actually cause those dormant hairs to start growing. So we don't want that. We want to cause less hair growth and not more. So it's really important to cool the skin down afterwards. And we talked about needing a series, usually, like I said, 6 to 10 treatments is pretty average. Some people with certain disorders like polycystic ovarian syndrome, they will need ongoing treatment because their body just likes to grow hair, and their hair is in that active stage of growth. So anyway, I'm going to go ahead and continue on doing Gina's treatment here. So if you want to just come and kind of zoom in a little bit. And hair removal is really tolerable. The laser that I'm using has a little burst of cold spray, a cryogen spray with each pulse. So it really makes the treatment very tolerable. It just feels like a little warm, mild pinch with each pulse. It goes by so fast though. All right, are you ready? All right, you can just see how fast this treatment goes. It's so incredibly fast. Here we go, 1, 2, 3. Oop. And if your patient gets a little jumpy, you just kind of hold on to them as you're going along here, because you want it, your laser to be at a 90-degree angle and flush with the skin. Alright, so that little section is done. And we're just going to continue on doing the full leg just like that. Depending on the area, you know, an upper lip that's really small, I can get that done in less than 5 minutes. Full legs usually take about 30 to 40 minutes on average. So it goes by really fast. And in 2 weeks, she's going to be really happy. She's going to have to shave a lot less often. The hair is going to be significantly thinned out. And after she completes her series, she's going to be good to go. So I hope you enjoyed watching my demonstration.